Good afternoon, Campbell Stewart. Let's begin the warm-up session. Are you comfortable working with other doctors and nurses?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I enjoy working in a team because I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivating and am equally comfortable working alone.
What are the current trends in nursing?
Some of the current trends in nursing include telehealth and technology in healthcare, the use of telecommunication and information technology to provide healthcare services. In the field of education, graduate education and advanced practice are on the rise. There is a push toward encouraging nurses to pursue higher education and advanced credentials, such as master's degrees and advanced practice registered nurse roles. There is also a shift from hospital-based care to community-based care, as more patients prefer to receive care at home or in outpatient settings. Alongside, nurses are coming up with innovation and entrepreneurship. That is, nurses are opening their own healthcare businesses, developing new products or services, or working for non-traditional employers.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Your preparation time is over. You can now start your roleplay.
Hello. I can see you're feeling quite breathless right now, and I'm really sorry you're going through this. My name is Campbell Stewart, and I'll be your nurse today here in the emergency department. My priority is to understand what's happening so we can get you the best possible care. To do that, I'd like to ask you a few questions about what brought you in, and then we can talk about what our next steps will be.
Oh, thank you, nurse. Yes, it's my breathing. It just suddenly got so much worse, and I couldn't seem to catch my breath. It's quite frightening.
I can only imagine how frightening that must be for you. May I know your name for the records, please?
My name is Mihiraa.
Mihiraa. So, if you can, tell me a little more about what happened today. What specifically brought you to the emergency department?
Well, I was just doing my usual chores around the house, and then suddenly, this breathlessness came over me. It's like I can't get enough air in.
Thank you for sharing that. To help us understand this better, could you describe how this breathlessness started?
It was quite sudden, actually, just this morning. It's been like this for about 3 hours now. I'd say it's an 8, definitely. Taking shallow breaths sometimes feels a tiny bit better, but mostly nothing helps. And yes, there's definitely a wheeze, and I've had a bit of a dry cough too, but no fever.
I appreciate you telling me that, Mihiraa. Now, I need to understand a bit about your general health. Could you please describe your general health and lifestyle, please?
Yes, I do have asthma, but it's usually well controlled. No known allergies, thank goodness. I used to smoke many years ago, but I quit. My diet is generally healthy, and I try to walk regularly, though not lately because of my breathing. And yes, I've been a bit stressed with some family matters, and I did have a bit of a cold last week, but I thought it was gone.
Thank you, Mihiraa. That's really helpful information. I'm taking everything you've told me into account. Given your symptoms, particularly the sudden onset of breathlessness and the wheezing, there are a few possibilities we'll need to explore. It's quite common for asthma to worsen, especially if you've been battling a recent cold or experiencing a lot of stress, both of which you mentioned. Sometimes, the breathlessness could also be a sign of a lung infection that's taken hold. Less commonly, but still important to consider, issues with your heart or even significant anxiety can sometimes cause similar feelings of breathlessness. To get to the bottom of this and understand exactly what's causing your symptoms, the next crucial step will be for the doctor to examine you thoroughly. They'll listen to your lungs, check your vital signs, and assess your overall condition. After that, based on their findings, they'll likely order some tests. These tests will help us get a much clearer picture of what's happening inside your body, so we can then start you on the most appropriate treatment as quickly as possible and get you feeling better. Oh, tests. What kind of tests will they do? I'm a bit nervous about that. I understand it can be unsettling to hear about tests, but they're important for us to pinpoint the cause and guide your treatment. Mihiraa, we'll definitely check your oxygen saturation, which tells us how much oxygen is in your blood. You might also need an ECG, which is a quick test to check your heart's electrical activity, and some blood tests to look for signs of infection or other issues. Depending on what the doctor finds during the examination, a chest X-ray might also be needed to see images of your lungs. If you become stable enough, they might also consider a spirometry test, which measures how well your lungs are working. Do you have any other concerns or questions about this or anything else right now? No, I think that covers it. I just hope they can find out what's wrong quickly. Please be assured, Mihiraa, that we're going to take really good care of you here. We'll be keeping a very close eye on you, constantly monitoring your condition to make sure we catch any changes right away. Our team is ready to provide prompt treatment as soon as the doctor determines the best course of action, and we'll implement any necessary interventions to help ease your breathing and get you feeling more comfortable as quickly as possible. Your well-being is our top priority while you're with us. Once you're feeling a bit better and we have a clearer understanding of what caused this episode, we'll also take some time to talk about how you can manage similar situations in the future. This is really important for helping you feel more in control. We'll discuss the importance of sticking to your medication schedule, even when you're feeling well, because consistent use can prevent these flare-ups. We'll also go over how to use your inhaler correctly, as sometimes just a small adjustment in technique can make a big difference in how effective it is. We can identify any specific triggers that might have contributed to your breathlessness today, so you know what to look out for and how to avoid them. Most importantly, we'll make sure you know exactly when and how to seek urgent care if you ever experience something like this again, so you feel confident in managing your health moving forward. We're here to support you in every way. Thank you, nurse.